Hi, thanks for joining me today on this learning adventure about the important role arts can play in healthcare. We have a lot of exciting ground to cover. Blair Sadler ran hospitals for adults and children for 29 years. How he got interested in this field of arts and healthcare might surprise you.
It was really a case of serendipity, and at the time, not the best kind of serendipity. I had recently gotten married, just turned 36, was an active squash and tennis player, and working at the Robert Wood Johnson Foundation. After a routine checkup that led to a biopsy of a mole, I was suddenly a patient in a major cancer hospital coping with a terrifying diagnosis, a malignant melanoma, and a devastating prognosis of less than 3 months to live. As we were struggling to make sense of all this, a friend arrived with a framed copy of a Rocky movie poster, a movie we had all just seen together. In my room, we removed the hospital's artwork from the wall and replaced it with a poster to inspire me. It gave me the courage and confidence that I so desperately needed. Its slogan became my motto. His whole life was 1,000,000 to 1 shot. In reality, my odds were equally bad. Later, I was at home with the poster in clear view, and we learned the best possible news. It was a misdiagnosis, not a melanoma at all, but a benign mole. The poster's message has stayed with me ever since. I didn't fully realize it at the time, but that experience started me on the road to appreciate the importance of providing healing environments for every patient, their loved ones, and the staff who care for them. A few years later, as the new CEO at San Diego's Rady Children's Hospital, it gave me the perspective and the confidence to put a value, indeed a dollar value, on including the healing environment in every building decision we made.
Phew, that's quite a story. No wonder Blair is so committed to advancing this field of arts and healthcare. Blair and I spent some time here at Rady Children's Hospital recently and saw many examples of how the healing arts are integrated into patient care. Beginning with the building itself, it sure doesn't look like a typical hospital, and I understand that the sculpture fountain out front has become the iconic symbol for the whole campus. I love the animal topiary and the healing gardens. There are 4 gardens, and 3 are named after Carly Copley, a courageous child who died of cancer at an early age. One is the Garden of Dreams and has many examples of animal sculptures designed to delight. I also like the way art is used to make waiting rooms more friendly and procedure rooms less scary. I loved seeing the collages that actually change their image and serve as a positive distraction for people. Even the nurses' stations feel more like home rather than a hospital, where everything is designed child-sized. These innovations are wonderful, but what's the data to support that they make a difference? Can art really measurably improve healthcare outcomes? I'm encouraged to learn from you, Blair, that there's a rapidly growing body of research starting with the physical environment itself. 2 years ago, a research team reviewed the world's literature on evidence-based environmental design. They reviewed over 1,000 published studies organized into 3 areas: patient safety, such as infections, medical errors, falls; other patient outcomes, including pain, sleep, stress, depression, length of stay, privacy, overall satisfaction; and staff outcomes, injuries, stress, work effectiveness, and overall satisfaction. They concluded, compared to 2004, the body of evidence has grown substantially. Well-designed physical settings play an important role in making hospitals less risky and stressful, promoting more healing for patients, and providing better places for staff to work. In a second comprehensive review of 350 articles in pediatrics, the authors concluded that a growing body of research shows that the physical design of pediatric care settings contributes to clinical and safety outcomes among patients and families. The nonprofit Center for Health Design is a great resource for new ideas and information. Blair and 3 architects have written a report in the IHI Innovation Series. This was published in 2009 and provides specific design recommendation and a checklist for people to use. For the arts and music, the Nonprofit Society for the Arts and Health is an excellent resource, and they have completed a comprehensive State of the Field report that was released in 2009 and is available on their website. Blair has co-authored a book, Transforming the Healthcare Experience Through the Arts, in which Don Berwick wrote a foreword. It is full of great examples of how the arts can make a difference. When I looked at these articles, books, and websites, I saw some amazing examples of how the arts can make a difference. Let's start with one, completely outside of the healthcare environment, but with a real healthcare message. In Sweden, behavioral scientists were interested in getting more people to use the stairs instead of an escalator as a way of increasing their exercise. They set up their intervention in a busy downtown area in Stockholm. Let's watch what happened. They asked the question, what if design made things more fun and actually encouraged you to do things that are good for you, like exercise more often? The results were amazing, an increase in the use of stairs by 66%. Quite remarkable. I guess we have something to learn from this. Blair gave me some good examples of how art can make the healthcare experience less scary, even enjoyable. Let's look at some of those remarkable artists, musicians, filmmakers, dancers, and storytellers who are truly transforming patient experiences. One of my favorites comes from Denmark, where a team of talented musicians, physicians, and nurses have been achieving some impressive results.
Now, doctors in Denmark say they have conclusive scientific proof that music helps to reduce the perception of pain and to speed up patient recovery. As Malcolm Brabant reports, they claim they can reduce the level of tranquilizers given to intensive care patients.
The music is permanently on in this intensive care unit. The result has been that patients require less sedation and their recovery times have improved.
You can close your eyes, all right, but you cannot close your ears. And man has been developed to be able to hear during dreams, during sleep. And we know that hostile environment, like alarms you can hear in the background, interferes with the cure, because the interaction of the brain and the body is very important for the cure, which comes from within. But placing patients in a non-hostile, friendly, fantasy-stimulating environment will enhance cure.
It's been assumed for quite some time that music is good for your health, but the process has been rather hit and miss, until now. Because what has happened is that a composer has come up with scientifically designed music that's specifically targeted at the body.
And this is the composer behind Music Cure. Niels Eye is constantly refining the music to match the scientific parameters required by the doctors in a unique collaboration between medicine and art.
The rhythm we all of us has from the beginning of life is the heartbeat of the mother. And by a pregnant woman, the heartbeat is around 60 beats a minute. So we took that as a test and created the music around this basic life-giving rhythm. And the results was actually breathtaking.
The researchers are now exporting their expertise, and they believe music therapy would have immediate psychological benefits in countries with poor hospital facilities.
I think it's very important for the rest of the world that they focus on this, because it's inexpensive, it has no side effects, and it's universally applicable.
So will music ever be able to replace painkillers or anesthetics? The Danes think not. But the music therapy team has identified the brain's hidden potential for self-cure. And the researchers are now on a journey of exploration to see what other magic lies within. Malcolm Brabant, BBC News, Copenhagen.
These musicians continue to test their musical innovations in a variety of settings with significant published outcomes. For example, research has shown that one day after heart surgery, music combined with bed rest measurably reduced stress levels of patients.
For school-aged children, researchers found that music after minor hospital surgical procedures reduced stress levels and the need for morphine. Individualized music selected by patients reduced stress levels during coronary angiography procedures. There are a variety of other examples of how the arts have made a difference. Individuals with cancer who participated in art therapy reported statistically significant reduction in 8 of 9 symptoms common to adult cancer patients, such as pain, fatigue, depression, anxiety, drowsiness, and loss of appetite. In an outpatient dialysis unit, patients who participated in an interactive arts program had significantly reduced depression and positive quality of life measures. Patients who were receiving high-dose therapy with stem cell transplantation who participated in a music therapy group scored 28% lower on a combined anxiety-depression scale and 37% lower on the total mood disturbance score compared to controls with music therapy. And at a time when all healthcare organizations are facing severe economic pressures, it is important to realize that arts programs can actually save money. For example, at Tallahassee Memorial Hospital, music therapists sang or played soothing music with young children to reduce their anxiety prior to an echocardiogram or CT scan. The need for anesthesia was eliminated 98% of the time for echocardiograms and 88% of the time for CT scans. In addition, there was an equivalent reduction in anesthesia-associated risks. Other results. Many hours of valuable nursing time became available for other needs. Equipment and staff could be scheduled for other procedures, and space in recovery rooms increased. Other researchers are examining the impact of the arts on the aging population. One study showed that there was a reduction in medication use and doctor visits between individuals who participated in a choral group and those who did not. It seems safe to say that the economic benefits of effective arts programs will continue to grow.
I'm convinced by the data that the arts really can make a difference in healthcare outcomes. So the next question is, how do you implement such evidence-based programs in your hospital?
Based on my own experience and seeing other successful programs in action, there are 10 steps I would suggest. First, build a clear connection between the arts and your organization's strategic goals. Examples could be improve patient, family, or staff satisfaction, reduce the need for pain medication or anesthesia, strengthen your organization's brand name and help to differentiate it in the marketplace, or attract new donors to support your organization. Second, find at least one influential leader in your organization who can effectively champion the idea. Third, start with a focus. Select a particular location, patient population, or program, as well as the type of arts intervention that are likely to succeed. Fourth, in collaboration with your university or research department, decide what outcomes you hope to achieve and what measures you intend to use. Fifth, develop a program plan, budget, and target dates, including funding sources. This can be an ideal opportunity for finding donors in the arts community who have not previously been involved with your organization. Sixth, seek nursing and physician support in the area where you intend to implement the program. Active nursing and physician involvement is critical. Seventh, keep your key stakeholders informed of your progress. Eighth, measure the impact and disseminate your findings at scientific meetings and in peer-reviewed journals. Ninth, share your findings with your constituents. Include stories of particular patients, families, or caregivers whose lives have been affected. And 10th, expand and replicate your program as appropriate.
A few years ago, the Agency for Healthcare Research and Quality was creating a video for hospital leaders about the importance of the hospital environment. Don Berwick was asked his perspective. Here's what he had to say.
Try to think about a perfectly designed hospital and it would be more reliable, fewer mistakes, fewer drop-offs, so everything there'd be precision, promises kept. It would be peaceful, healing, a quiet place where patients can use their limited energy to get better instead of to fight the environment. And most especially, the loved ones of the patients are there all the time. There'd be a sense of things in their place and a place for everything. I think it would be simpler. I think that the clutter and the complexity and the machines and the bells and the whistles need to be managed out of the care. I think it would feel more like home, probably, and therefore it has to be more customized. And somehow all of this resting on science, because we're there in a technical enterprise that has to use knowledge and machines and drugs correctly. So underneath all is confidence that we're going to do the right thing every single time.
So environments that cause no needless harm, noise, sleep deprivation, anxiety, confusion, loss of privacy, those are environments I believe people really want. And environments that provide maximum convenience, choice, and control are ones people really, really want. So in addition to all the other things we're doing to improve safety and quality, there is now ample evidence that creating healing environments is a key to improving patient care outcomes and the healthcare experience.
In this short time, we've tried to introduce the exciting connection between the arts and healthcare. There's much more to learn. We've given you resources to continue your journey. I urge you to return to your organizations and design healing environments that people really, really want. In doing so, let's also create places that are less stressful, even relaxing, in which to work and heal. Thanks for watching.